In the news this week, wait 7 hours to save $35. Hospital source blames ambulance ramping on cost of living crisis. A WAME News exclusive.
Also tonight, concerns raised over impact of NDIS autism changes on multicultural communities. Record drug busts as the Border Force, federal and state police join forces to stop upcoming armed robberies. And later, Dr. Andrew Miller's comment.
This is The Evening News with Ivan Loom and Naliva Thorne.
Good evening. Hospital sources have told us Western Australia's health system is under severe strain, with ambulance ramping and overcrowded emergency departments now being fueled by cost of living pressures. One Perth hospital insider who asked not to be identified said some families are avoiding their GP because they can't afford the out-of-pocket gap fee of around $35. Instead, they're heading straight to emergency, where waits can stretch up to 7 hours. Doctors say that means patients are turning up with relatively minor conditions, like a sore thumb, while more serious cases brought in by ambulances are forced to wait. Health unions have long warned about ramping across Western Australian hospitals, but insiders now say rising cost of living are directly worsening the crisis.
One client came in with a sore thumb in the ED department, and just clients just cannot afford, are not paying the gap fee, and they're just rocking up to the ED department. It's roughly about $35 normally, roughly out of pocket at the moment, and so a lot of clients, because of cost of living pressures, are rocking up to the ED department just for any condition. Obviously, there are ambulances as well with clients who are ramping up, and it's just at crisis point. They can't afford to pay the gap fee. So obviously, either cost of living, rent, housing crisis, this is a cost of living issue, and it's a cost issue, so people go to ED and it's free. It's a free consultation. So if people don't want to pay their GP, the gap fee, which is what Medicare pay, and the gap fee is whatever it is, $35, so therefore clients are going to the ED. But for some people who are on a low income, you've got a mortgage, you've got family, you've got groceries, petrol, rent, mortgage rate, obviously mortgage rates coming down, that's a lot of financial pressure. Or clients waiting 7 hours, 5 hours, 7 hours, just lined up in the corridor. Lined up, it was just chockers.
In a statement, a spokeswoman from the WA government admits our state's health system is under unprecedented strain, with more than 1,000 ambulance calls in one day and 300 patients awaiting aged care. Officials say critically ill patients will always be prioritised, and all Western Australians should be able to access the healthcare they need when they need it. They added, we'd also like to acknowledge the dedication of staff working across the system to maintain safe and timely care for the community, noting efforts to ease pressure through initiatives like the virtual emergency department.
There are concerns that removing autism coverage from the National Disability Insurance Scheme will disadvantage multicultural patients with language barriers. Federal NDIS Minister Mark Butler announced the change this week to control cost blowouts. While Perth community leaders told our reporter Paige Reid it is unclear whether cowed people with autism will be better or worse off.
You talked about what the children deserve. Can you just elaborate on that? What do they deserve?
Look, the children, as we all say in terms of the overall NDIS participants, they need a customized, tailor-made service, and they and their parents need what everybody refers to as choice and control. These are concepts that are not easy to implement, to achieve, when they are such a small proportion of the monies that is being spent in such a large and unwieldy system like NDIS. So rolling it out into the states, will, as far as I'm concerned, and with all the people in the safeguards I just talked about, will make it possible that the children and their families will get exactly what they need, customized to their particular needs and concerns. So it covers the whole gamut of things, from a medical perspective, social perspective, educational perspective, right across, and their social connections. Look, at the end of the day, they are human beings like the rest of us, and many of them, or indeed I'll argue most of them, have got the potential to be as good a human being as you and me. So that's what this is all about. So yeah, so you are really covering everything, anything and everything.
What are your thoughts in terms of like autism and CAL? There's going to be a language barrier between these two. Kind of what are your thoughts on how they're going to kind of get around that?
Look, at the end of the day, when we talk about tailor-made services, customized services, you have to keep in mind the transectionality of various factors. And in the case of called multicultural communities, what you're talking about is not just language, but cultural barriers as well. And one of the most important cultural barriers is stigma. A lot of people of called backgrounds don't want to accept, the realities of disabilities in their own families for all kinds of cultural reasons. So it is a very important factor. And of course, language. I mean, if you're not proficient in in English, then the chances of of being able to navigate a very complex system like NDIS is going to be that much more difficult than someone who's proficient in English. And particularly if you come from a country where there is nothing remotely close to what we have in Australia in terms of the NDIS, you've got another issue that needs to be addressed. So yes, there are lots of connections between the called communities and how they can or cannot effectively and adequately access not just disability services, a range of community services.
How does the multicultural framework fit into all of this?
Look, it fits in very well with this, and the reason I say that is the multicultural policy framework requires every government agency, including whichever agency that's going to be responsible at the state level to roll out the Thriving Kids program. It could be the Office of Disability, it could be another agency. We're not quite sure, but regardless of which agency it is chosen to roll out this program, they are obliged to fulfill what is required of them under the multicultural policy framework. So from an inclusion perspective, the points that I mentioned in terms of cultural barriers, in terms of linguistic barriers, are issues that they need to deal with it. And they've got 2 years to start addressing that. More importantly, and it's not just the multicultural policy framework that is important from the NDIS perspective. The state government's got a language services policy which requires every agency to ensure that they provide professional interpreting services where a person of a language of a cultural and linguistically diverse background requests one. We also have a substantive equality policy. So, from a both Equal Opportunity Commission perspective, as well as Office of Multicultural Interest perspective, there are things in place. There are policies and frameworks in place which will, as far as I'm concerned, absolutely ensure that the interests of the called communities, their families and the children are safeguarded well and truly.
So will multicultural people and CAL people be better off with these changes?
It is premature to say, in conclusive terms, whether they're going to be better off or worse off, because we don't have the details, or at least adequate details of the size of the program in terms of the state contribution. The Commonwealth has indicated what it's going to be putting, and more importantly, the framework of how it's going to be implemented. There are lots of factors that are going in favor of the multicultural community in terms of what I mentioned, starting from the minister to the head of the Office of Disability, the chair of the Multicultural Advisory Council, our own human rights advocate, the Office of Multicultural Interest, and what have you. So there is no reason to believe that they won't be better off. As to the cuts that government agencies or the government itself makes at the Commonwealth and federal level, these are factors that people like me can never predict. So even when they do happen, I believe there will be adequate safeguards and enough advocates, both within government and outside, who will ensure that we are not disproportionately impacted.
WA Police, the Federal Police and Border Force have carried out a major drug bust under Operation Estevan. Senior officials announced on Friday that 185 kilograms of meth were found hidden in rice bags shipped from Pakistan. At the same time, uncovering links to an allegedly planned $300,000 armed robbery. A 35-year-old man from Doubleville has been charged with importing drugs and a failed robbery and will face Perth Magistrates Court on August 27th. He faces a maximum penalty of life in prison. Police also said one suspect had a loaded gun. AFP Assistant Commissioner Price Scanlon said Operation Estevan began in December adding that 230 kilograms of meth have been seized and 8 people charged across 3 operations since January.
Pro-Palestine protest was held across Australia today as the conflict in the Middle East continues to worsen. Demonstrations took place in major capital cities, including Perth, where thousands gathered in the afternoon in response to reports of famine declared by groups backed by the United Nations. Protesters assembled at Forest Chase for speeches, calling for stronger accountability and humanitarian support, before marching for an hour through the CBD to Hyde Park in North Perth. Greens MLC Sophie McNeil joined union representatives and community leaders in addressing the rally, urging authorities to take a firmer stance on the crisis.
Just what will it take for this gutless, cowardly Albanese government to sanction Israel? What will it take? They've sanctioned Russia, they've sanctioned Iran, they've sanctioned Myanmar. But the number one killer of children, aid workers, journalists, they refuse to sanction. Shame!
A woman in her 30s has been charged over the death of an infant in Alexander Heights. The infant was found in a stormwater drain on Lasella Road on Monday afternoon at around 1 p.m. Multiple police resources were deployed to the area following the grim discovery. Authorities confirmed that the homicide squad detectives charged a 31-year-old woman with 1 count of concealing the birth of a deceased baby. She is due to appear in Perth Magistrates Court on 12th of September. WA Police Assistant Inspector Jessica Securo, officer in charge of the homicide squad, gave an update to the media.
This, of course, is highly distressing for the entire community, detectives, and, as you can imagine, the family of the infant. The assistance of the community in this matter has been invaluable. The support has been ongoing, and the family and community members have provided us with so much information, and we're thankful for that.
A new campaign is about to launch, encouraging Western Australians to nominate for this year's local government elections. The state government and WALGA will roll out the You Are the Right Material campaign next week, highlighting the importance of diversity in councils from different ages, professions, genders and cultural backgrounds. Local government is described as a vital level of democracy, with councils providing services that communities and businesses rely on every day. To nominate, candidates must be Australian citizens over 18, connected to their local district, and have completed the mandatory candidate induction. Nominations open on August 28th and close at 4 p.m. on September 4th. Voting for local government elections takes place on Saturday, October 18th.
Really happy about this campaign. It'll be hitting your social media and other outlets very, very soon, and I absolutely encourage people to nominate. The second phase of the campaign will be about turning out the vote for our local government elections on the 18th of October. And if you care about your community and the outcomes, the positive outcomes that I know that so many communities desire for their local area, I absolutely encourage you to take on the responsibility of voting at your local council elections on October the 18th.
And now here's Dr. Andrew Miller with his weekly medical and news commentary.
Hi, thanks for your time. The news that there are people seeking to save money by getting general practice type assistance from emergency departments is very frustrating, on top of the issues that are being faced by our public hospitals at the moment. It would be a very difficult thing for people who wanted to wait that long because, of course, if someone sicker arrives whilst you're waiting, then they will go ahead of you in the queue because emergency departments have a system called triage, which means that they divide people into categories according to how urgent it is that they be seen by the doctors to be investigated and diagnosed and treated. And people who the triage staff assess as being of low priority will wait behind people who may arrive after them who have a more urgent presentation. So it's a very bad way to try and seek routine medical care. They won't turn people away from emergency departments, they will see all patients, but it may be waiting a very long time and it's not really appropriate. People should be seeing a general practitioner, and what it means for our governments is that they need to be planning better for these services, providing more access to low-cost care for people who need it in the community. The government's trying to increase the incentives for bulk billing, but the government needs to adjust the Medicare rebates for bulk billing to a level that is more sustainable for general practices, which, like every other business, have faced massive increases in costs, particularly in property and in staff over the years, and they have to be able to have a sustainable business to stay open. Thanks very much for your time.
Thank you, Doctor. And just a reminder that our bulletin will be on a break for 2 weeks.
That's right. Our company and our office is moving. Time for a new home. And it's not too far away from where we're at as well. We're still in West Perth, still at the, I suppose, the centre of Western Australia, so to say, right?
Where the action is happening.
Where all the actions, where all the politics are, and so on. Every other thing in the city. But of course, we'll be back. We'll look forward to bringing you a new bulletin from our new home.
And that's our weekly news and current affairs. We have the latest news on our website, wamnnews.com.au.
Subscribe to WAMN Extra News Club so we can continue our work in the community. wamnews.com.au/news/extra, supporting independent local news, keeping democracy strong. From Melly, Paige, Peter, and myself, wish you good health, good night. See you in 2 weeks' time. Thanks for watching.
Thanks for watching.